Knock, knock. How you doing today?
Good, how are you?
Doing good. My name is Malik Dade, and I'll be your nurse for today. And today I'll be doing your infant assessment. Today we're just going to be asking a few questions, getting some measurements, and checking vital signs on your infant, which is a gorgeous little man, as I can see.
Thank you, sir.
Yes, ma'am. Yes, ma'am. So first off, I'm going to start by asking you a few questions on your infant to see how he's developing so far. And so if you would just, answer us truthfully, because, if you don't, then we don't really know how the baby is developing, which he looks like he's developing good. Alrighty, so first off, how has he been eating?
He's been eating white more than what we seen he was eating at first.
Okay, I got you. Yeah, he when babies start to grow more, the more that they want to eat, just like us. The bigger we get, the more that we can consume. All right, and since he's a few months, of course he's been eating more than what he normally was eating a few months ago. All right, so next question is he breastfed, or do you bottle feed, or are you doing both? Or?
We're actually doing both.
Okay, so you basically breastfeed until you basically run out of milk or you can't produce as much.
True.
The baby's still crying, so baby needs him a bottle, huh?
Yes.
All right, so that's good. That's good. Any allergies to any milk, or I mean, is he fine on
He
milk?
was allergic to soy, but we got all that settled. So
Okay.
now he's on the right thing.
All right, so I bet basically he's normal right now. Okay.
Right.
All right, so that's good. How is he sleeping right now?
He's sleeping good. We'll have him in his crib, and he lays on his back. We make sure we check on him. And, whenever he wakes up in the middle of the night, then that's when he'll go into our bed.
Okay.
But he's been sleeping great.
Okay, so you're aware of what SIDS is, sudden infant death, right?
Yes, sir.
Okay, so that's good. So you know that the baby needs to sleep on his back at all time, because sleeping on his stomach can be a risk for aspiration or a risk for, anything,
Yes.
Breathing impairment or anything like that. And we do not want to risk that, because that can potentially cause SIDS, also known as, sudden infant death, which we really don't know how the baby dies until after the baby dies, when it has sudden infant death. And it normally comes from, parents that's not educated about the syndrome or whatever that occurs, basically when you let a baby sleep on their stomach, or something like that, just possibilities that can happen. So you want to prevent all of those things by, for one, letting him sleep on his back, which y'all are doing great with, as you have just told me, of course. So all right, so that's good. And then you did just confirm to me that he does sleep in his own bed until he wakes up in the middle of the night, want a bottle or want some breast milk or whatever. Okay. So since he's a few months old, we're gonna check some milestones that we expect him to be at. Milestones meaning that basically at this point in time we should be expecting him to do this certain thing. If a baby is 8 months, we expecting that baby to crawl or whatever.
Yeah.
If that baby ain't crawling or potentially standing up ready to walk, it could be a problem with some formalities of the leg or anything like that. So so what we're gonna do first here, we're gonna ask you a few more questions. Is he starting to smile?
Yes, sir. He'll
Okay.
smile every now and then.
Okay, so he is smiling. That's good. Is he reacting to certain voices, certain lighting, and everything like that?
Yes, he
Okay,
knows
so-
his mama's voice,
Okay,
of course.
yeah, he hears
Yeah.
mommy's voice. I'm gonna tell you why. Mommy's voice. Whenever the baby is in the womb, anytime mommy is talking, the baby hears it. So the baby gets used to mommy's voice, which means that when the baby comes out of mommy's womb, the baby is basically already used to mommy and ready to interact with mommy. So that is why he probably reacts to mommy's voice more than anybody else's voice. Alrighty, so that's something that some people doesn't know. Okay, so let's put him on the bed so we can start getting some measurements and some weights and everything, and checking some vital signs. Alrighty, so you can scoot this chair on over some. Alrighty, so that's good. So first off, what we're gonna do, we want to check his pulse and his respirations and his heart rate and everything like that. So I'm going to go ahead and check his respirations and all of the areas. All right, his breathing sounds normal. While I'm checking that, I'm gonna go ahead and check his aortic and his tricuspid and his pulmonic and his maltal. That's all dealing with the heart. Just checking the rate and how strong it is and making sure that it's normal. Making sure there's no abnormalities with the heart rate or anything. Alrighty, so. And what we want to do, we want to check this for a full minute to make sure, or whatever. And with an infant pulse rate or whatever, which we will check, the pulse rate will be at least 160 in that area. We don't want it any lower. Not potentially too high, but in that range of 160, 170, we're fine. That's normal. All right, so. At this point, we would check the temperature, in which the temperature normal range will be 97.5 to 99.5, nothing lower, nothing higher. Maybe if it's 97.4, we won't be worried, but if it drops down to 94, then we'll be worried because the baby's normality is 97.5. All right, so what we're going to do here, we're going to measure the infant, and we're going to weigh the infant. So let's put that back. What we want to do, we want to measure from the top of the head to the bottom of the feet, and put a dot at each location. Put a dot there, put a dot there. Alrighty, so he is 40 centimeters long, which is good. For his month and age, that's very, very good. Also, since we're going ahead and checking that, we're going to go ahead and check the circumference of his head. And jot that down. Alrighty, so the circumference, 27. Also, while looking at this, as we see, we have the clothes off the baby. We just have the pamper on. We're gonna go ahead and check the nipple lining, which that is fine, and the chest is normal. We want to go ahead and listen to the bowel sounds and everything. Make sure the bowel sounds is good. Make sure everything is good, which it sounds normal. Also, while looking at the stomach, we want to look at the umbilical. The navel and everything. Make sure that is good. Make sure that hasn't had any bleeding or intactness or anything. You want to feel for the femoral pulse, which will be right here, and it feels good. Okay, that feels great. Also, we want to check for the colorness of him. He looks great. His color looks everything. We want to check the fingertips. Make sure that he has all 5 fingers for one and everything. Also, what we want to check the ears. Make sure, since he's already laying here, let's go ahead and check all this. So we want to check the ears. The thing that people don't know is the tip of the ears had basically lined up with the eyeballs. So, and if not, then that could be some some problems or whatever. So we want to make sure that is all good, which this does look good. All right. So we want to check for the pinkness of the lips, which it has. We also want to check the nose. All right, what we want to do, we want to close one nostril, make sure he's able to breathe out the other nostril, which he is. Alrighty, so we also, when I was checking the fingers, I didn't mention, but what we want to do is check for, blood flow, which means we push the fingertip. You see how my fingertip goes white, and then it goes immediately back red. That means I have good blood flow in my fingers, which that's what we need to check with the baby. And it looks that he has good blood flow with the fingers. All right, so we're gonna basically we already have started it, but we're starting the head and toe assessment. I just didn't verbalize that. We want to make sure that the legs are symmetry. meaning that they are lined up perfectly because one leg shorter than the other. That could be some problem. Also, when checking the eyes, we want to make sure that the eyes are basically darn near perfect. We want to make sure that with the eyes and the ear checking or whatever, we want to make sure that it's no Down syndrome symptoms. Down syndrome, the ears could be lower, and the eyes could be, with Down syndrome formalities or whatever. We're gonna take the diaper off. We're gonna check for his genital, make sure that his penis is in the correct position, which it is, in the middle where it needs to be. Make sure that his testicles are not lower than they need to be, because that could be some formality problems. We need that to be right where it needs to be. All right. So we're gonna put this back on because we don't want to get peed on, do we?
No.
All right. So with the head, we also want to check for sutures. We also want to check his fontanelle, which is basically his soft spot. We want to make sure that it's not depressed, because if it's depressed, that means that it could be some problems with dehydration or anything like that. And we also want to make sure that there's not any swelling, which means that he could potentially have some swelling inside of his skull. So you want to make sure that, we make sure we check that, and you want to make sure that you keep an eye on that also. But with him being a few months, it should be okay. Also, we want to check with the molding of the head. Now, since he's a few months old, he shouldn't be molding anymore. It should be the correct shape that it is. But by him laying on his back, sleeping a lot, it could, flatten the back of his head. But since he's a few months, it should be good. It shouldn't be molding anymore. Also, like I said, we've checked the ears and the eyes and everything. We also want to make sure that we check the red reflexes or whatever. We also want to check the dog's reflexes. And what this means is, whenever I turn the baby to the side, his eyes should look up at me. You feel what I'm saying? Meaning his eyes is still following me while I'm turning him over to the side. And whenever I turn him to this side, the same thing should happen. While I'm turning him over to the side, I'm going to go ahead and pick him up while I'm supporting his head. And I'm going to make sure that everything, is good. I want to go ahead and flip him over while still, supporting his head. I want to check his spine. Make sure his spine is straight and good, no lumpy lumps or no, detachments or anything like that is going on in his spine or whatever, which everything feels normal as well. Okay, so let's lay him back down while still supporting his head. We want to check the range of motion in his lower extremities, make sure that everything is good, make sure, like I said, the symmetry is good and everything. Also, we want to check his hips. We're going to go ahead and disattach his diaper again and check his hips and make sure that his hip has no displacement. We want to grab it outward and make sure that the hip does not move out of joint or whatever. Alright, so we're going to put the paper back on because, like I said, we don't want to get peed on, do we? Alright, so we want to check the feet also. So, with a baby don't like to have his feet touched. So we're going to rub our finger on that foot. Make sure he wants to move it away or, jumps his toes or whatever. Also, we want to check with the stepping reflexes, which means that I'm going to pick this baby back up. And what he wants to start wanting to do is step. Of course, the baby can't walk. He's only a few months old. But the baby wants to try to, do a couple little steps. Alright, so with this all being done, it's like we're finished. Your baby is completely healthy, normal. His weight is beautiful, which looking at him, we can tell. But we're going to go ahead and get an actual weight on the baby because we didn't do that. So let's go ahead and get a weight before we done. Alright, and the reason I left the weight at the end and this next step at the end is because the baby might cry. And we know that mommies don't want the baby to cry, but sometimes we have to make the baby cry. And which I don't have an otoscope with me because I'm at home doing this video. But what we do right here is we would check the eardrums, make sure that they are good, make sure that we don't see any fluid in there and anything.
Right.
And with that, you know, of course, the baby might be crying and everything, but after that, the baby back in mommy's hands. The baby is good. What I would do, I would document. I would ask mommy, do you have any questions for me? I would also tell mommy all the vaccines that the baby has gotten today. The baby will get what vaccines next time the baby comes. I will give mommy her paperwork, letting her know what the milestones for the next few months should be, and make sure that mommy knows that baby is growing, and baby's gonna want more to eat, and baby's gonna keep growing. So let her know what milestones are needed to be reached within these next few months, so that next time that mommy comes with baby, that you know she can either tell us, well, you know, this has been basically normal, or this has not been normal. So this is all that we needed to do for this infant assessment. We thank you for your time, mommy. Nurse Dade will be on his way. If you have any more questions, please be free to ask. If not, then mommy's infant assessment is now complete. Thank you for your time.
Thank you.
All righty.